Luyengo Clinic in Eswatini in southern Africa has up to 350 patients a day, with a dozen babies tested for HIV. The United States President's Emergency Plan for AIDS Relief, PEPFAR, covered 80% of the clinic's costs. It has more than 3,000 people living with HIV enrolled on life-saving treatment. When the U.S. cut foreign aid at the end of January, patients were scared.
People were frustrated and they fear death.
The head nurse said that for now, the clinic has enough treatment. The collect-and-go lockers to pick up medicine are still functioning, but they've had shortages in medical material in the testing lab. Since 2010, new HIV infections have dropped by more than 70% in Eswatini, and death rates have been halved. A spectacular turnaround of the HIV epidemic. The funding cuts may unravel all of this.
New infections are likely to rebound. It means that the investments that we have made in putting people on treatment is going to be affected. It also means that we are not going to be able to generate the strategic information that is needed to inform us in terms of where are the new infections taking place, who are being infected, why are they being infected, and how many of them are getting infected. This is the kind of value that the UNAIDS bring into the HIV response.
UNAIDS has been working with countries to increase domestic resources for HIV and reduce reliance on outside funding, including in Eswatini, which still has one of the highest HIV prevalence rates in the world, 25%.
We are running around to say, how can we ensure that those who are in treatment, first, they must remain on treatment, that make sure that we don't disrupt the services, even if we don't have the budget as I speak, but we need to look for money.
Treatment is essential, as is preventing new infections, which has now become a big worry for NERCHA's director, the HIV/AIDS coordinating body.
We are focusing on the priority populations, which is men who have sex with men, female sex workers, as well as our vulnerable populations like our adolescent girls and young women, because for them, they are about 3 to 5 times more likely to get new HIV infections compared to their male counterparts. So we're very much worried that without the support now, the communities are going to suffer.
Nonchero Kumalo recently lost her job educating her peers about HIV awareness and health, and fears her peers will lose out.
Most of us from this rural community, we do not have the money to access all the services that are provided in the clinics. But when we are together, motivating each other, the people are capacitated to go and get the service. We need these education sessions where we get the correct information so that we are on the right track.
The right track to a safe, empowering, and healthy future.